Hello friends, I am Dr. Girish Bhalerao, Senior and Chief Consultant Orthopedic Surgeon here at Mumbai. Today we are going to talk about problems in hip, especially affecting the mobility and range of motion. So hip joint is a ball and socket joint where a greater surface of this ball is within the cup. It is a joint formed between your thigh bone and your pelvis. The thigh bone, the proximal end of it has a globular ball and the pelvis has got an acetabular cup. They are congruent joints giving you range of motion in 6 axes of flexion, extension, adduction, abduction, internal and external rotation. However, there are certain situations, especially offering joint pain to this particular hip profile. Sometimes these pains are very debilitating to affect your activities of daily living, even if you walk few steps in your house. So most recently, after COVID, a large group of patients, especially a younger group of patients, have been suffering from a condition called avascular necrosis of the hip joint. This avascular necrosis affects the blood supply of your hip and allows this to undergo necrosis, that is death. Because of this, there is a gradual collapse of the hip joint and the congruity of the joint goes for a toss. This does not allow the hip to move in its particular axis and causes a progressive collapse, because of which the pain, the deformity and the posture gets very severely affected. In this case situations, we do offer a solution in the form of minimal invasive customized robotic joint replacements. Minimal invasive means we do not invade any tissues or do not disturb any of your soft tissues. Conventionally, the joint replacement of the hip has been approached through a posterior approach, also called southern Moore approach, where few or some muscles are cut and the approach to the joint is made to offer a joint replacement. However, there is a very minor risk of dislocation. Also, sometimes posterior joint replacement programs can have its own challenges. So this particular thing is settled with a novel approach which is called minimal invasive direct anterior approach. It is a true minimal invasive approach where no muscles are cut, the soft tissues are absolutely intact and the joint is approached anteriorly. Because of this, there is no blood supply and immediately after the surgery, the patient is able to mobilize on the same day. The requirement of physiotherapy and rehabilitation is much less and your activities of daily living are allowed to you right from the next day of surgery. Second aspect of this joint replacement program is something called customization. So to offer this, we do your surgery on a computer software program. We feed your scans into our system and do your surgery before the patient is taken to the surgical theatre. In this way, the joint replacement, the sizes, the shape, the dimensions, the actual configuration is preset before the real surgery. We do have the entire idea of your bony anatomy and replicate a joint replacement which would pacify your re-establishment of biomechanical axis which may have been deviated because of this arthritis. Going further, we also make use of robotics. So we use the most advanced technology with which we have the most highest precision so that your pre-operative planning is exactly replicated onto your bony anatomy. When we put so many efforts, we exactly know your dimensions, your clinical alignment, which will offer you a range of motion which will make you feel this joint to be more natural, allow you to not only get back to your functional activities but also challenge yourself to high demanding activities like sports and games as well. If you have any other issue related to hip arthritis and joint replacement program, please feel free to connect with us and let us help you get back to your game. Thank you.